Hey, everybody, and welcome to the food addiction section and module of this course. So let's just talk about food addiction, and I'm going to give you a general overview of why we need to talk about this and why it's so crucial. Okay? So, what's covered in this module? So, understanding food addiction and recovery and all the challenges this problem poses, substance dependence and why this work is so difficult, but I make it really easy for you, and what to do. So, solutions and understanding recovery at all levels physical, emotional, and spiritual. Okay? So, a lot of this is based off of my training as a functional neurologist and just understanding the brain behaviors and the hormonal system and how all of those tie together. And then also, some of this is based off of the work of Lynn Elliott Harding with Food Frenzy and Eating Sober in Recovery. So, she defines the definition of food addiction is Lynn Elliott Harding explains the definition of food addiction as a chemical dependency disease, not as a behavioral problem or a lack of self-control. Okay. Now, what does she mean by this? She means that the chemical properties of certain foods can cause irrational behavior and depression experienced during recovery and a prolonging of the disease due to chemical addiction. So why is this important? Well, partly because sugar acts on opioid receptors in your brain and it causes you to become addicted. And that's something that we're going to be covering in this module as well, and why that occurs, and why gluten acts that way as well, and just other food groups or properties that have these similar traits to them, and why big companies use them basically to get you addicted, and why we don't think about food addiction as a problem when in reality it's one of the world's biggest problems, probably more so than alcohol or drug addiction. Okay. And so I do agree with Lynn in some aspects of this, and I've taken off of her work and I've expanded upon it by saying that it can be a learned behavioral problem as well, because there's a part of your brain that does that. And you can actually retrain your brain and use exercises to prevent that from happening, and basically use your frontal lobes or the conscious part of your brain to overpower that and take back control, so that it's not just this unconscious thing that, oh, I ended up at the 8 p.m. with a bucket of ice cream that's empty, right? And I don't know how I got there with a spoon in hand, okay? So just like I said, I've expanded upon this myself, and I was a food addict, and it's taken me a long time to really understand why I crave certain foods, why I always resorted to certain foods, why I did binge eating or overeating, and that's been a lot of what I see in my patients and what they struggle with, and what I've been able to help them overcome just from basically trial and error over the last 18 years of experimenting on myself, as well as working with thousands of patients to help overcome this. Okay. So from my own experience to understanding the whole system of food addiction, not only is it a chemical and behavior imbalance, like Lynn says, but it is also a brain imbalance. And that's kind of my paradigm. And it's why not address all three aspects, the behavior imbalance, the brain imbalance, and then the biochemistry or hormonal imbalance, and just really give an all-encompassing approach so that we don't leave any stones unturned. So by understanding each aspect of food addiction, we can break the cycles and gain back control. So basically, here's like a little food dependency questionnaire that you can fill out. So you can just write down, what is your relationship with food? So do you have a good relationship? Do you have a bad relationship? And so let's define a good relationship. Is it something that, it doesn't control you, that you can go without certain foods for an extended amount of time? Or is it something that you have to have it and you just keep unconsciously going back to it? And how you know this is give it up for a week. If you can't, you're addicted. Okay. And a lot of people say, well, I enjoy coffee, or I enjoy caffeine, or, I just enjoyed the taste of this, or I enjoyed the taste of that. And it's like, well, you can still have that in a week. So go ahead and, give it a shot. And most people can't do it. And what that is indicative of is addiction. And then, what is your first memory of food? I know that there is one patient, and her first memory was she was under her bed eating a can of Crisco. And when she was like 4 or 5 or something like that, and she was hiding it. So that was kind of like her first experience with food. And what we can see is that from that aspect, she's ashamed of her behaviors and she's kind of confiding in food to get this dopamine response. Okay. And then, are you a compulsive overeater or undereater? So, what this can look like is maybe you eat a lot and then you fast for like the next 3 days, but then it ends up crashing your blood sugar and then you start overeating again, right? Or anorexia or bulimia, those are very common issues as well, and something that needs to be addressed. And then, what was your first problem with food? So, was it something that you were kind of shying away from people, or maybe you put like a cookie in your back pocket when nobody's looking? Maybe you're doing things that are kind of irrational. So maybe you're just gorging on food when nobody's around, or you're going out of your way to get a certain food. So, kind of what does that look like for you? And then, do you have a history of eating disorders? Is there alcoholism in your family? And then later in this module, we'll go over the genogram so you can kind of map that out. It's kind of interesting to see. And then, what is your family's relationship with food? Is this something that's been instilled all of your life and you think that it's normal and it's not? And then, do you use alcohol or drugs to control your weight? And then, how often are you eating? Is there anything you eat too little or too much of? And then, are you or anyone else concerned about your eating habits or your weight? Okay, so is that like your family members notice that you're like binge eating or overeating, or are you kind of like you keep gaining weight and having that issue, and people are kind of concerned about it? I know sometimes it's hard in the South because they don't really call you out on it because it's seen as rude, but sometimes it can really help somebody. So we don't even realize that we have addiction because food isn't thought to be an addictive substance. However, we are seeing more and more symptoms, results of food addiction than ever. What do these look like? These include obesity, overweight, depression, anxiety, fatigue, and pretty much every issue in civilized society. So basically, you can see that how food allergies, GI issues, all of these things can be tied back into food addiction because we're using them as a crutch, especially to get dopamine or to get that feel-good response, or we just don't know how to eat properly because we were never taught. So it's not just alcohol or opioids that we can become addicted to, but anything that is a stimulant can trigger addictive behaviors. Other examples include like social media, food, exercise, video games, and caffeine. So let's just take a bird's eye view of food addiction. So if we look at it, what is addiction? What are the behaviors with it? What is the biochemistry? And then what is our brain telling us? Okay. And then common addictions, we have alcohol, drugs, and then food. Maybe something that you didn't even realize could be an addiction. And then, are you addicted? Yes, no, not sure. And then identifying addiction, so looking at your genogram, that's like family history of other things. So even though it may, your grandfather may have been an alcoholic, is it manifesting in you differently as food? And then what were your answers to the questions previously? Do you have any food allergies? And then gluten. Gluten acts on opioid receptors. There's more and more research about that coming out. So the final best part is a 3-step cure. So the physical side, the emotional side, and then the spiritual side. And then we talk about transcendence. And I like that word because it talks about overcoming something that you thought may not have been possible and actually becoming a better version of yourself and taking charge for what you want to do and what you want to create. Okay? So what you'll be learning in this module is why we have to identify and prevent food addiction, how to change your brain, behaviors, and balance your hormones to beat this, how to identify if you have a food addiction, how to understand your triggers, understand why certain foods cause addiction, how neuroscientists work for major corporations to get you hooked, why big companies use these foods to keep you wanting more, and how to break the cycle forever and beat binge eating. So, your goals for this module are to complete the questions truthfully, okay? Sometimes we like to deviate from the truth, and then identify what foods you may be addicted to, change destructive behaviors from unconscious behaviors to conscious, perform the neurocognitive reprogramming that we teach in this program to change your behaviors, and then change your environment for success, engage with the group for support, and then reap the benefits of having control of your life again. Okay. So I know we talk about in the group calls how it almost feels like you don't have control. And what would it feel like? So if you close your eyes and you think about if you could just make that decision to put down the M&Ms or the sugary foods or whatever else it may be for you, and how much control that would give you, and how you can apply this to the rest of your life. Okay, so I look forward to seeing you in the module and hearing your feedback, and we will see you soon. Bye-bye.